Understanding the hidden risks of antidepressants, why stopping them can be so difficult. Introduction. Selective serotonin reuptake inhibitors, SSRIs, and serotonin norepinephrine reuptake inhibitors, SNRIs, are among the most widely prescribed medications for depression and anxiety. However, despite their widespread use, growing evidence highlights significant risks associated with these medications. Beyond their potential to cause emotional numbness, agitation, cognitive decline, and sexual dysfunction, SSRIs can also lead to severe withdrawal symptoms that make discontinuation extremely challenging. Understanding these hidden dangers is crucial for individuals considering or currently using antidepressants, as well as for healthcare providers tasked with managing mental health. Disclaimer: this podcast is for informational purposes only and does not constitute medical advice. Discontinuing antidepressants should always be done under the guidance of a qualified healthcare provider to minimize withdrawal risks and ensure safety. How SSRIs and SNRIs work, a brief overview. SSRIs and SNRIs are designed to alter brain chemistry by increasing the availability of serotonin, and in the case of SNRIs, norepinephrine, in the brain. By blocking the reuptake of these neurotransmitters, these medications aim to alleviate symptoms of depression and anxiety. However, the brain adapts to the presence of these medications, and over time the body becomes reliant on them to maintain a state of balance. This adaptation often leads to a phenomenon known as neurochemical dependency, making withdrawal challenging and often painful. Side effects and long-term concerns. While SSRIs and SNRIs may offer short-term symptom relief for some individuals, their long-term use carries a range of potential side effects that can severely impact quality of life. Emotional numbness and apathy. One of the most frequently reported side effects is a diminished capacity to experience emotions, known as emotional blunting. Studies have shown that SSRIs can impair emotional processing and reduce both positive and negative emotional responses, leaving individuals feeling disconnected from themselves and their relationships. Severe agitation and induced bipolar disorder. Paradoxically, some users experience heightened anxiety and agitation, a phenomenon known as activation syndrome. In some cases, this agitation can escalate to manic or hypomanic episodes, leading to misdiagnosis of bipolar disorder and the introduction of additional medications, perpetuating a harmful cycle. Cognitive decline and brain changes. Emerging research indicates that prolonged use of SSRIs may lead to structural changes in the brain, including decreased gray matter volume in certain regions. These changes may contribute to cognitive decline, impaired memory, and difficulties with executive function. Sexual dysfunction and long-term consequences. Sexual side effects, including decreased libido, difficulty achieving orgasm, and erectile dysfunction, are common among SSRI and SNRI users. What's particularly concerning is that for some individuals, these effects persist even after discontinuation, a condition known as post-SSRI sexual dysfunction, PSSD. Birth defects and developmental risks. Studies have shown that prenatal exposure to SSRIs is associated with an increased risk of birth defects, developmental delays, and autism spectrum disorders. Pregnant women prescribed SSRIs must weigh the potential risks to fetal development against the benefits of continuing treatment. The challenge of SSRI and SNRI withdrawal. Discontinuing SSRIs and SNRIs can be remarkably difficult due to the brain's adaptation to these medications. Withdrawal symptoms, often referred to as SSRI discontinuation syndrome, can be severe and prolonged, affecting nearly 50% of users attempting to stop. Common withdrawal symptoms include dizziness, vertigo, and balance problems, severe mood swings, irritability, and anxiety, brain zaps, electric shock-like sensations, insomnia and vivid nightmares, flu-like symptoms such as fatigue and muscle aches. Research published in the Journal of Psychopharmacology reveals that withdrawal symptoms can last for weeks, months, or even years in some cases. Additionally, a subset of individuals may experience protracted withdrawal syndrome, characterized by persistent psychological and physical symptoms that continue long after discontinuation. The misinterpretation of withdrawal symptoms. A significant challenge with SSRI withdrawal is the frequent misinterpretation of withdrawal symptoms as a relapse of the original mental health condition. This misdiagnosis often leads to the reinstatement of antidepressants or the addition of other psychotropic medications, perpetuating dependency and delaying recovery. Psychiatry's role in downplaying withdrawal risks. Despite mounting evidence, the psychiatric community has historically minimized the severity and prevalence of SSRI withdrawal. The belief that these medications are non-addictive has led to a lack of adequate support and resources for those attempting to discontinue use. This systemic failure often leaves individuals to navigate the complexities of withdrawal alone, increasing the likelihood of relapse and emotional distress. Why SSRIs can be addictive. Though not classified as traditional addictive substances like opioids or stimulants, SSRIs can induce a form of neuroadaptation that parallels the physiological changes seen in addiction. The brain's dependency on serotonin modulation can lead to severe distress when the medication is removed, prompting the body to react as if it is experiencing withdrawal from an addictive substance. A neurochemical trap. Just like stimulant drugs, such as cocaine, SSRIs flood the brain with serotonin, creating an artificial chemical environment. Over time, the brain downregulates its natural serotonin production in response, which means that when the medication is stopped, the brain struggles to restore balance, leading to distressing withdrawal symptoms. Navigating discontinuation. Why a gradual taper is essential. Abrupt discontinuation of SSRIs can be dangerous and is rarely recommended. Instead, a slow, methodical taper under the supervision of a knowledgeable healthcare provider is crucial. A gradual taper allows the brain to readjust slowly, minimizing the severity of withdrawal symptoms. Successful tapering strategies include decreasing dosage incrementally over an extended period, often several months or longer. Incorporating lifestyle changes such as stress management, mindfulness, and nutritional support to aid the body's recovery. Monitoring symptoms closely and adjusting the tapering schedule as needed. Conclusion. While SSRIs and SNRIs may provide symptom relief for some individuals, the risks associated with long-term use and discontinuation cannot be ignored. Understanding the hidden dangers of these medications, recognizing the challenges of withdrawal, and advocating for better resources and support are essential for ensuring that individuals have the knowledge and tools to make informed decisions about their mental health.